Hello, I'm Dr. Sundari Mase, Sonoma County's health officer, and I'm here to share the latest update on coronavirus in our county with you. Here's my report on cases. As of yesterday, August 2nd, we have 3,113 confirmed cases, up 169 cases over the weekend. 1,455 are active, 1,619 are recovered. We now have 39 deaths, with 2 more deaths reported since yesterday. We've done a little over 75,000 coronavirus tests as of now. The rate of positive cases is 6%, and that reflects a 7-day average. Based on the most current data available, the 14-day average, our case rate is 188 per 100,000, 88 cases above the state's threshold. So given that information, you may be wondering what our status is with regard to state monitoring after 3 weeks. We will continue to remain on the monitoring list as we currently do not meet state benchmarks pertaining to disease transmission and ICU bed availability to remove us from the list and now allow us to move forward towards relaxing restrictions. Over the last 2 weeks, we have reached 944 new cases, which tells us disease transmission is too high, well over the standard for containment. We need to bring that below 100 per 100,000 people living in the county in order to meet the state's benchmark for more relaxed measures. The good news, though, is that we are meeting some standards, including the number of people getting a COVID-19 diagnostic test and a recent reduction in overall hospitalizations, or at least a leveling out of hospitalizations. Our job is to stop the spread. It's our only way to make progress against this pandemic, get off the watch list, to get back to opening some parts of our community and to relax some of the restrictions. And we need your help to do this. Each one of us can do our part. In what ways? You can wear a facial covering when outside the home, especially when you're indoors at grocery stores, pharmacies, other enclosed spaces. You can maintain 6 feet of physical distance from those outside your household at all times, whether indoors or outdoors. You can wash your hands frequently and also follow general hygiene measures. And you can avoid social gatherings. Social gatherings have been shown already in our data to be leading to more and more cases of COVID-19. Whether it's a gathering with your extended family or friends, it's very important to limit and not participate in these kinds of gatherings at this time. Stick with members of your household at this time. So we've asked the state to help us with the outbreaks that we're having in the skilled nursing facilities. As many of you know, another 6 deaths were reported since Friday, all of them from skilled nursing facilities and residential care facilities. It's really tragic that more than 80% of the deaths in Sonoma County due to COVID-19 are from these facilities. Though we've been working really closely with the skilled nursing facilities, the fact is that the state has the regulatory authority for these facilities. Because of this, we've asked the state to come in and intervene more intensively than they have been doing in the last month. This week, they'll make site visits and issue daily recommendations. State strike teams have the ability to transfer patients to other sites or even to create a state-run alternate care site if they determine that that's necessary. It's important to remember that these skilled nursing facilities are doing their best to fight this disease under very dire circumstances. We appreciate how committed they are to working with us and doing the right thing. And now they will also be working very intensively with the state to see how they can improve the situation and mitigate COVID-19 in their facilities. Our community question for today: what exactly is antibody testing and how is it different from other tests? I see that the county is now offering antibody testing to school personnel. Can you say more about this? Antibody testing is done through a blood test to identify if COVID-19 antibodies are present in the body. Testing positive for these antibodies does not necessarily indicate immunity. However, a benefit to antibody testing is that if you test positive, you likely had COVID-19, and you might be eligible to donate plasma to help others beat the disease, especially those who are hospitalized and severely ill. We've been conducting COVID-19 antibody study in Sonoma County over the past few months. At first, we focused on first responders and healthcare workers, and community members who actually had COVID-19 and their close contacts. Then we opened it up to essential workers who reported working during the initial phases of shelter in place. Those people who are working in grocery stores or construction, utility workers, childcare providers. Now we're asking school personnel to come in for antibody testing. This includes teachers, administration, maintenance, all current school employees, and those who worked in the school setting during 2019 to 2020 academic year. This information will give us another perspective on community spread, and we will continue to gather this data through August 14th. If you fall into the categories that I mentioned above for an antibody test, please call 707-565-4667 to schedule an appointment. Have a safe day, and we will talk again on Wednesday.